Hi everyone, this is Bianca from Dr. Ivan Marx, and today I wanted to talk to you guys about something very specific. So have you ever noticed on your young children's teeth or even on your own teeth, sometimes you have these little white spots, little brown spots, and no matter how much you brush, you just can't get it off? So that can actually be a variety of things. The first thing we look at is demineralisation. That is usually because of poor oral hygiene. Your teeth start to demineralize in that area due to the excessive plaque in that area. The second thing you might look at is fluorosis. This is something you will also notice from quite a young age, and it tends to turn a little bit more towards the brownish side, and it's on all your teeth. You usually see it on all your teeth. And then the third one we consider is enamel hyperplasia. This also presents quite similar, except you will notice this as soon as your baby starts getting their permanent teeth. You will notice these white and brown layers on their teeth. So in a nutshell, I just quickly want to explain all three of those things to you and how to differentiate between them. So the demineralization is, like I said, it's usually quite close to the margin of the gums. It's due to poor oral hygiene. It's not something that can be reversed, but it is something that can be stopped by implementing a good oral hygiene program. The second one, fluorosis, like I said, you will notice this as soon as your baby starts getting their permanent teeth also. Sometimes it affects all the teeth, most of the time all the teeth, sometimes only selected few teeth. The question is, how do we fix that? Again, it's not something that means the tooth is not in a healthy condition. You can simply fix it for aesthetic purposes also. And then the last one, the enamel hyperplasia. This is also like a deficit in your enamel. It means when you were a baby and the enamel formed on your permanent teeth, it wasn't a very good quality. It can be due to malnutrition, due to a deficit in minerals, vitamins. It can be a genetic condition as well. Again, how do you fix it? The question I always ask is, the tooth is not unhealthy. The tooth is still healthy. It just doesn't look nice always. So most of the time, people fix those things for aesthetic reasons. Sometimes it is a little bit more difficult to clean, and then you start getting cavities on those teeth, especially on the molars, and then we have to intervene with restorative dentistry. So the thought I want to leave you with today, not all of the stains you see are usually from unhealthy teeth. It doesn't always mean there's cavities. It doesn't always mean you don't take care of your teeth. The best would always be to consult a doctor, a dentist. Come in, let's have a look. Let's determine what is the cause of this, and let's determine how we're going to fix this. The way to fix this will depend on how old the person is. Obviously, if it's a younger child, you try to implement good fluoride treatments, good oral hygiene programs until they are old enough to do some restorative work. Obviously, if you're much older, you can look into the aesthetic part of dentistry with crowns and veneers, etc. So not all stains are bad, but you don't need to have them. So book your appointment today so that we can help you.
Your dentist, your choice.